Tēnā koutou katoa. Welcome to our webinar on immune-enhancing foods in the face of COVID-19. So before we begin, and welcome to everybody once again, thank you for joining us. A couple of things I'd like to say just before we launch into this. The first thing is, please do think about questions and share those with us and all of our speakers as we go through. But to manage the questions at the end of the three speakers, it would be great if you could just save your questions until the last person has finished speaking, which will be Michelle. And then do feel free to fire those through to us on the chat function. And what we'll do is we'll work our way through those. And if in the event that we do run out of time, we will have a log of what those questions are, and we'll make sure that we come back to you via email or personally to you all individually. The other thing I want to say today is that being the 9th of December, I would just like to acknowledge the tragic events that happened this time here in the Bay of Plenty 1 year ago at Whakaari, White Island. So our thoughts are with all of the families, whānau, iwi, and anybody affected by those tragic events, and still will be to this day. So we're all thinking of you. So moving quickly into an introduction then from me. I'm Melanie Ruffell, the Stakeholder Relationship Manager at the Riddet Institute, and my role here is really to facilitate these webinars and also just remind you, I guess, you might have seen a couple of these already, just remind you about who we are and what we do and how we're here to support you. So the Riddet Institute is leading a program called The Science of Food, which is part of the HVN High Value Nutrition Science Challenge. But the Riddet Institute, beyond that, is a centre of research excellence, and our focus is working in advanced food science and helping to provide the fundamental scientific knowledge and understanding in these areas, and also to train a new generation of science leaders. So there is a lot more information about us if you don't know about us already. We clearly have our own website, we have phones, etc. So we can talk more about that any other time. But in the context of why we are delivering this series of webinars to you is that, as I say, we are running the Science of Food program for the High Value Nutrition Science Challenge. And that challenge is one of 11 national science challenges funded by MB. And recently has been awarded what we call tranche 2 of funding, which takes us through to 2024, which means that we're able to provide the support and engage with industry stakeholders and provide that help, assistance, guidance, etc. that you might need, and partner with you, work with you to help you get your novel and innovative foods to the markets. So HVN also has its own website, lots of information, really wonderful team there that are ready on standby to take your calls and answer any detailed questions. But this just gives you an indication of the kind of partners involved in this network. This is just a few, there's many more, so apologies if anyone is missed there and would like to be on the next slide, give us a shout. And the purpose of HVN is effectively to provide support and assistance to develop high-value foods, particularly with validated health benefits, with an aim to driving economic growth for Aotearoa New Zealand. And the HVN priority research programs, that really means these 4 areas of health, which are areas that they're very keen to focus on growing our knowledge and product base, etc. But there's also the possibility to work in areas of science beyond that. So you don't have to focus on those areas, but as they're called, you can see they're priority research programs. So that's the detailed clinical focus of work. Then there's 2 enabling programs, of which we are the Science of Food, and the Consumer Insights program is run by Plant Food Research. So as you can see, there's 2 programs here to help support the clinical trials. And effectively, we're here together with the Consumer Insights program to help ensure that those foods which are going into the clinical trials are actually foods that people are going to like and want to eat and are suitable for market. And if there's any technological challenges around the production of these foods, particularly around new innovation, that's where the Science of Food program at the Riddet Institute comes in. So a lot more information available to you on the HVN website, and I know many of you already will have heard of this before. I'd also like to point out on this slide that there's also a good deal of focus on working with Māori businesses, and there is a lot of information around how to engage with HVN if you are a Māori agribusiness, and for other businesses who want to work to the Vision Mātauranga principles, there's information there as well. So a lot of helpful guidance. Also very helpfully, there's some money to be tapped into, and this is the great thing about HVN. In addition to all the expertise which is available, there is some funding available to help get this work off the ground and provide the financial support that you might need, as well as the expertise around the science and technological aspects. So again, HVN has a hotline where you can pick up the phone and talk to them about all of this and find out exactly what might work for you. So this just gives you a snapshot of the kind of funding available. I should point out that there is a requirement for some industry co-funding, and again, just talk on a case-by-case basis with HVN about that, and you'll get that clarity from them about what that would look like for you. So the science of food, this is just a little overview slide of really how and where we fit in, maybe some pictures rather than words, kind of saying, I think, what I've already said, which is that we're here really to provide this wraparound support to industry and to stakeholders, and we work in the sort of areas that will help develop the capacity around scale up, technical work, new product development, compliance support, all of those things which you need to basically have sorted, really. If you're going into one of these clinical trials, you need to have a food which is going to be acceptable to consumers and can deliver the benefits that you want to claim. So again, that's where the Science of Food program comes in, and we work with a number of partners to support us in providing this kind of guidance. And two of them are with us today, so we're very grateful for them to be speaking to you about this topic around immunity. And then, of course, Ollie is also with us, who is leading the immune platform in those 4 clinical priority research areas. So certainly enough from me, and I'd now like to just introduce you to our 3 great speakers who are going to go through with a fairly quick overview of their sort of areas of expertise. So we'll start with Dr. Olivier Guesset from the Malahan Institute, and as I say, leads the immune program at HVN. Then Dr. Peter Brown, who is an IP attorney and consultant, will talk about some of the recent IP advancements. And then we'll close this session with Michelle Cubitt, who is also a consultant in regulatory support and market access, and she's going to talk about things to consider in terms of getting to market when talking about these immune-enhancing foods. So I will hand over now to Ollie.
So thanks for the introduction, Melanie. So my role here is to give you really a very short introduction of the immune system. I mean, this would be at least an hour-long lecture, and then to kind of present the immunological activities of 2 food products we selected for this webinar, and we'll discuss the regulatory and the IP implications of these 2 products later on. So I just want to kind of briefly introduce the immunological activity. So these are the 2 products we selected. So there's the Wellmune, and then most of you know the Actimel product as well. So now very, very briefly. So in general terms, there are 2 arms of the immune system. So there's the innate immune response, and then there's the adaptive one. I guess in the current context of COVID-19, you probably appreciate that there's a lot of vaccine development going around the world now. So most vaccines would try to elicit either a B and or a T cell response. So these are kind of 2 critical players of the adaptive immune system. The B cells are kind of your antibody factories, so they generate antibodies. These would then opsonize or neutralize the SARS-CoV-2 virus, for instance. Then on the other side, you have T cells. So cytotoxic T cells, positive T cells, they would be very important to kind of kill viral infected cells. They do other things. They can also kill tumor cells and things like that. But in the context of COVID-19, they would kill the virally infected cells. Then we also have Cd4 positive T cells. So these are the helper cells. They're not cytotoxic per se, but they kind of carry out helper functions throughout the immune system, including trying to make sure that you have high affinity antibody production by B cells. So on the other side, you have the innate immune response. So that's the kind of immune response or immune arm you're born with. So upon birth, it's ready to go. So this would include soluble proteins. So you have a complement system. So these are soluble proteins circulating throughout the blood and the lymphatics. They carry out similar, or some of the proteins carry out similar effective functions than antibodies, not with the same specificity, but they can also neutralize and opsonize pathogens. Then you have natural killer cells. They can carry out similar functions to a cytotoxic T cells, but again, without the specificity of the T cell receptor. And then you have macrophages. They mop up everything that has been killed and make sure you regain tissue homeostasis. And then you also have dendritic cells. So they are kind of key. They should actually be in the middle. They kind of build a bridge between the innate and the adaptive immune system. They typically phagocytose like macrophages. They present antigen to T and B cells. So without dendritic cells, you actually can't mount an efficient adaptive immune response. So they're very key. And in most cases, they're actually targeted by vaccine designs. So on the upper left here, it's kind of the same thing. Here, I just wanted to point out that all of these cells that I just introduced, they all come from the bone marrow. And I think in terms of nutrition, it's kind of important to point out that the quality of your diet not only dictates the function of those differentiated cells in the periphery, but they also change hematopoiesis. So not only with nutritional interventions can you modify the function of these differentiated cells, but you can also work upstream at the level of the bone marrow. On the right, I'd like to also point out that any immune reaction has its energetic cost. So if you have a significant insult to the immune system, such as sepsis or injury, your basal metabolic rate can ramp up by more than half. So all of that needs to be properly fueled, and that's where nutrition comes in as well. So the table here, again, summarizes the big hallmarks, so the key characteristics of the innate and adaptive immune arm. So adaptive always brings, is slower, can take up to a week or two to fully develop. However, it is the only immune arm that has high specificity and diversity. Innate, on the opposite side, is ready to go, but it doesn't have a lot of specificity. Now, in most textbooks, you will also see that one of the key differences is that the adaptive immune system has memory and the innate immune system does not. That's in textbooks. We've known now for a couple of years that this is not entirely the case. So you also have memory within the innate immune arm. I don't really have the time to explain to you exactly how it works, but it's basically a epigenetic reprogramming of innate immune cells. Now, very importantly, so the memory of the adaptive immune system is antigen specific, whereas the memory of the innate one is not. So point in case, let's go back to the context of COVID-19. So if some of you might at some stage receive a COVID-19 vaccine, that vaccine is only good against COVID-19. It will not be good against any other pathogen in very general terms. However, if you consider innate memory, there's a hypothesis going around that, for instance, the BCG vaccine that has nothing to do with SARS-CoV-2 at all has beneficial health impacts against SARS-CoV-2, and this would be done via the innate immune memory, so trained immunity. So how can you reach a state as a human being of a trained innate immune system? So one of these ways is via beta-glucans. And this brings me to the first product. This is Wellmune, which is nothing else than beta-glucan isolated from baker's yeast. So this is the structure here. There are various beta-glucans out there. I don't really have the time to go into detail. There will certainly be a structure-function relationship between those different structures. But Here we're talking exclusively about the Wellmune product, which is a whole beta-glucan particle product. So what does Wellmune do and how does it work? So Wellmune, because that beta-glucan basically mimics a fungal infection. So here on the left, you have Candida albicans, the cell wall structure. The beta-glucans here are represented in green and in yellow. So Candida, for instance, is a quite ubiquitous fungi most of us carry around. They're opportunistic pathogenic. So in immune suppressed individuals, they tend to create problems. So the immune system has to have a way to deal with that. So one of the way it develops was via specific receptors. So one of the receptors that binds beta-glucans is dectin-1 here, represented on the right. So downstream of dectin-1, there are various immunological pathways, signaling pathways activated, one of them being NF-kappa B, which some of you might be familiar with. And also downstream of that, or in parallel to that, you will initiate that epigenetic reprogramming of the innate immune cell. So that's basically what Wellmune does. It teaches the immune system how to have memory by mimicking a fungal infection. A second receptor that is relevant for the Wellmune product is complement receptor 3. Also binds beta-glucan with one key difference is that it only binds soluble beta-glucan, so only small particles of that. So if you have a whole glucan particle, a large particle, it engages a dectin-1. If that gets broken down, it can bind CR3. So CR3, so complement receptor 3, has two binding sites. One of them, as the name of the receptor says, it binds complement. So C3 is one of the soluble complement proteins that you find in blood and in the lymphatics. So it binds C3 on one side, and then it binds beta-glucan on the lectin binding site. So that's important because there's always checkpoints in immunity. The immune system, you never want an unwanted immune reaction because they are quite potent and they can create quite a lot of pathology. So that's a system that the immune system has developed to make sure that what is recognized as complement opsonized, so C3 opsonized, is actually a pathogen, and that's where the beta-glucan binding site comes in. Now, importantly, the glucan, the lectin binding site and the complement binding site do not have to be cross-linked by the same particle. So that's shown on the right here. So if you ingest, for instance, a product like Wellmune, you can basically provide signal 2 to an innate immune cell, and then it's more likely or can more efficiently recognize a complement opsonized particle. So this can also be a tumor cell which would never under any circumstance express beta-glucan. So you basically provide signal 2, and then it's easier for that cell to signal via CR3 because it only requires signal 1. So this, I found that slide, which is I think a nice summary of what would actually happen if you ingest a product like Wellmune. So first thing that happens, you will train the immune system in the gastrointestinal tract, so in those gut-associated lymphoid tissues, such as the Pace patch. So you engage all myeloid cells in that area, including dendritic cells. Dendritic cells love to talk to T cells, so you already have that kind of Th1 from gamma-producing reaction happening in the gastrointestinal tract, right underneath the epithelium. So dendritic cells love to travel as well. So that reaction can also take place then in distant lymphoid organs when those cells traffic through the lymphatics. At the same time, so again, Wellmune is a whole glucan particle product. At the same time, these bigger particles can go to the bone marrow where they're broken down to smaller particles. Those smaller particles can then bind the lectin binding site of CR3. Neutrophils, again, come from the bone marrow. So those emerging neutrophils that will move into the periphery, into the blood, they have already received or receive signal 2, so that when they are in the blood, they more efficiently can recognize opsonized particles, so which can be a virus, which can be a bacterium. So this is reflected in the kind of clinical evidence there is right now for Wellmune. That's straight off the Wellmune website. So as you can see, most of the clinical evidence revolves around upper respiratory tract infections, either in athletes or in sedentary people. There is also some evidence that it works against allergy. And this immunologically can be explained by the fact that if you train a dendritic cell to polarize a T cell towards a Th1, Th17 pathway, you will polarize it away from an allergic Th2 response. So that makes actually quite a lot of sense immunologically. So to summarize just what Wellmune does, so it has two effects. It has a long-term effect, so you epigenetically modify the innate immune system via trained immunity, via the receptor dectin-1, who recognize the big particles. This again has an impact on T cell polarization, so you polarize T cells towards an interferon gamma IL-17 producing phenotype. This is typically the phenotype you need against fungal infections, so it makes a lot of sense. And by the mere fact that you do that, you drive T cells away from an allergic Th2 phenotype. So it can also work indirectly against allergies. Then you have a shorter acting effect. So that's the smaller particles of beta-glucan that bind CR3. That interaction is not indefinite. So at some stage it's going to come off, or the receptor is being internalized. So it's a shorter acting effect on those on CR3. Now quickly to the second product, Actimel. So I would say most of its established immune effects will be mediated by vitamins, so vitamin D and B6. And then there's also a probiotic effect via lactobacillus casei. So I really don't have the time to properly introduce all these vitamins and what the immune activities are. Vitamin D is a very, very important vitamin for the entire immune system. It is a hormone. Has massive impact on T cell polarization, making sure that you have enough regulatory T cells. So this is very important for immune tolerance. So tolerizing the immune system against innocuous particles, for instance, in the gastrointestinal tract. It induces the production of IL-10, which is important for Treg development, drives it away from an inflammatory IL-12 production, and is also very important for antimicrobial peptide production in the gastrointestinal tract. Vitamin B6, I guess, is important for numerous cellular processes, but the most relevant ones for immune function would be production of IL-2, which is a growth factor. So as soon as you have clonal expansion of T cells, you will require IL-2. So if you are B6 deficient, you won't be able to expand really your T cell repertoire. It's also important for lymphocyte differentiation in general, and also for antibody production. So these are very general activities of vitamins. You can appreciate that it's also very essential for other cells in the body, not just immune cells. So when we're talking about the probiotic, it's very, very difficult to establish what a probiotic actually does, especially in human, because it's not a standardized system. So instead of telling you what that particular probiotic does, I think it's better to list the key or the most common characteristics of probiotics, which I've done here. So most probiotics are known to bind either to the gastrointestinal epithelium or to the mucus layer. They tend to enhance short-chain fatty acid production. And by the mere fact that they are a bacterium, they will have pattern recognition receptor ligands. So they are engaging innate-like receptors such as TLRs and things like that, which again drive trained immunity. The benefits of probiotics, I would say it's very individual, because you're talking about a living product, and it really depends what kind of gut microbial communities you have in your gut. So it's impossible to say exactly what it's going to do in your body, because it's highly individual. But one of the mechanisms would be trained immunity, a bit like the Wellmune product. So just to summarize the product Actimel, again, it's going to have a long-acting effect as well as a shorter-acting effect. The vitamin effects will be short-acting. That's why I guess you would have to take that product on a daily basis to make sure that you are not vitamin D and vitamin B6 deficient. And then most probiotics will always have a trained immunity impact. But again, I would like to stress that this will be very individual because all of your bacteria in the guts have or express pattern recognition receptor ligands. So it's very individual what you already have in your guts. That's going to dictate how you're going to respond and what your immune system is going to do. If you, on top of that, you have a probiotic. So just as a general conclusion to this talk, I'd like to say to this very broad audience that so food products can have either a very broad impact, like vitamins. They also impact the body outside of the immune system, or they can have a very specific effect. So one example would be one single receptor that is expressed on a single immune cell subset. So it spans the entire breadth of broad to very, very specific. It can have, so nutritional products can have either short or prolonged effects. So prolonged, anything that has to do with epigenetic reprogramming will have a prolonged effect. But again, vitamins are very short-lived and they provide a short-lived benefit. So going back to the Wellmune product and to the beta-glucans, I think that's where I think the formulation, the processing of how you extract the beta-glucan and what the source is, you would have a quite diverse spectrum of potential impacts if you have different products that have been formulated or processed differently. Because if you have the Wellmune product itself has larger particles, so it's going to engage both receptors that are very briefly presented, so the dectin-1 as well as CR3, you can also process or generate a product that has exclusively soluble beta-glucan. In that case, you do not engage dectin-1. You will not have a trained immunity impact, but you will still provide some biological or immunological impact via CR3. So that's where the formulation processing comes in handy and might be definitely the source of intellectual property. Then, again, my talk was extremely short and there are dozens of examples out there, but you can appreciate just by that heterogeneity of the impacts that you can certainly design products with different bioactives in them to provide a very targeted immune health benefit. So whether you want to target, for instance, viral infections, bacterial infections, whatever, or you want to have a product against allergic disease, you can pool various bioactives that will potentiate each other and will create that targeted immune health benefit.
So yeah, I'm going to be carrying on with the patent strategies in immune health, carrying on from what Ollie was talking about, and again, focusing on the two same products. So again, we're looking at the Kerry's product, which is the Wellmune, and then Danone's product, which is the Actimel, and looking at what they did with their patents. And then we'll step back from that, look at a bit of the insights that I presented in the recent reports that just came out from HVN around patent strategies, and then just end on a few tips and tricks that that might be relevant to New Zealand companies looking at doing similar things around the immune health space. So with the Wellmune, if you just look at the bit of a backstory, this happened, the actual company that started this was Biothera. They actually developed a lot of this intellectual property well before Kerry got involved. And they actually had a product on the market, which I found, which is actually immunity straws that you're meant to drink with milk. So that was quite an interesting backstory before Kerry came along. It was in about 2015 that Kerry came and acquired the intellectual property in the product, Wellmune. And that actually came with quite a big, substantial patent portfolio, which included the manufacturing technology, a lot of the development work that went into it, as well as obviously the therapeutic applications. And interestingly, it wasn't just from a respiratory health perspective. There was also quite a lot of patent literature around cancer therapeutics and mood and cognition, interestingly. And around the same time, Kerry actually acquired Ganeden, which is the patented probiotic. It's a spore-forming probiotic that also has implications towards both immunity and digestion. So you can kind of see that Kerry's strategy in this was very much about acquisitions and moving into that space. So Biothera, the patent, if you look over on the right-hand side on that slide, they've got something like 46 patent families that they've got around this technology with pretty substantial portfolio value. And their patent strategy has been, if you look in the middle, they've got quite a global reach in terms of where they've filed their patents for this technology. Interestingly, a lot of the patent work was actually filed in the couple of years following the acquisition from Kerry. So it just shows that probably Kerry actually put quite a bit of money into that innovation work that was had already started. But even before that, Biothera had actually acquired quite a lot of intellectual property along the way from a number of other companies that you can see down the bottom. A number of those will be just inventors that probably worked at Biothera, but there's definitely some companies there that they would have been involved with early on. And I think the key take home here is it's not about developing everything yourself in these very complex areas of science. It's really good to make sure that you partner with the right groups and work together. So when you look at, and this is just kind of building on what Ollie was saying before, these are the top cited patents that Biothera had by other patent holders. And a lot of them actually relate not specifically to the therapeutic applications, but the method of manufacture. So how you can differentiate the IP by, there's one they're looking at methods of producing soluble glucans versus the insoluble forms, for example. Or highly purified versions, or even there's actually some patents that I found that relate to the sensory profile of the glucans themselves. So it's really interesting to see how companies have kind of differentiated, that haven't just focused on one aspect of the technology, it's multiple aspects. Okay. So this is one of the patents, just to give you an example. So this is 12 years down the track. So this was originally filed in 2008. And the patent, it relates to a method of reducing upper respiratory tract infection symptoms in stressed human subjects and improving global mood state. So that's by applying the beta-glucan, obviously, and consuming that, which is quite interesting because if you look at the Phisans health claim, it doesn't relate at all to mood state or improving your mood state. It's entirely focused on the actual upper respiratory tract infection. A number of the patents in this patent family aren't limited to that mood or treating people in a stress state for upper respiratory tract infection. So they've obviously tried to keep it broad as possible, but in a number of countries, they've had to limit it to that. So that's, I don't know if there's anything else I wanted to mention on that one. Yeah, so I think that's when you compare it to, and something I'll mention at the end is that a lot of companies, when they try and patent these types of things, it's a way of covering the health claims. So the ingredient companies can go out and speak to customers and almost license the health claim or the dossier potentially, but they essentially have an umbrella intellectual property where they can control that health claim. And that's what I suspect Kerry and Biothera have been trying to do here. So I'm going to jump over to the Actimel story. And yeah, as Ollie mentioned, it's actually quite interesting because I think it was around just after 2010 that Danone actually removed their health claim related to LKCI and immunity and focused entirely on the claim related to the vitamins, obviously because EFSA has essentially not allowed any health claims in relation to probiotics. But what's really interesting is Danone's patent portfolio, and particularly in relation to the probiotics, in this product, Actimel, is entirely focused on the probiotic. It's got nothing to do with the vitamins at all. In this word map, if you want to call it, this is based on how many times these words actually appeared in Danone's patent portfolio. So you can see things like Lactobacillus KCI, influenza vaccine, inflammatory response. These are the types of the phrases that are popping up in relation to their IP that they put towards these products. So it's a fairly substantial part of their portfolio. They're obviously working on other things as well. Food product and dairy product pop up as pretty big ones, but beyond that, they've done quite a bit of work around Lactobacillus casei. So just to give you a taste of the patent filings, the first one actually was in 2001, so that's coming off the 20-year patent term next year. So it's not too far away. What's quite interesting about that is it was actually challenged in Europe by Nestle, and there was about a 4-year battle where they were trying to inactivate that patent, but it looks like Danone eventually won that, and the claim was actually awarded, and it's along the lines of using this, the probiotic to enhance systemic immune response towards pathogenic microorganism of the respiratory tract, so relatively broad, and which is presumably why Nestle was up in arms about it. But beyond that, there's actually been a series of patents that have become there's relatively narrow. So there's one there about delayed type hypersensitivity reaction, which is all about eczema. There's a patent there focused around the method of manufacture. And there's even one that's quite interesting there in 2009. I don't know if the scientists got a little bit carried away here, but never, obviously, I don't think there's any health claim made in relation to this, but prevention or treatment of an upper respiratory tract infection in smokers. So I haven't seen anything commercialized around that, but they were quite interested in that space for a while. And then it all kind of dropped away in about 2010. Danone didn't file any more patents that I could find in relation to L. casei. And they seemed to switch tact around that point, which is probably when they removed their health claim and would focus more on their health claim towards the vitamins and minerals. They actually started to change tact. I've seen a lot more patents that they've filed for bifidobacterium. So that's their Activia patent. And that doesn't have an immunity focus. It's more about a digestive health angle to it. But most of the patents that I could find in that space were actually around the method of manufacture and improved processing and functionality rather than the actual health benefit itself. So what's quite interesting here is actually on the Danone website, instead of making health claims related to the probiotic, they're actually highlighting that it's a patented probiotic, which adds that kind of element of innovative or differentiation. And they talk to the vitamins, or in this case, I think for the digestive health, they talk to the calcium, which helps normal digestion. And they also talk about general live cultures, which helps with lactose digestion. So just what's really interesting when you look at probiotics, even though the EFSA has been pretty difficult when it comes to health claims, regardless over the last 5 years, everything in red there is showing new patent filings in the last 5 years. The ones that are really showing up, bacterial strains, probiotics, there's a big cluster of red there showing that companies are still progressing this because they really believe that there's opportunities in this probiotic space, despite the pushback from regulators. So I think it's definitely one of those areas you have to have quite a lot of patience and also persistence. And I think a strategy that's been taken by a number of companies is linking the probiotic and relying on with the supporting vitamins and minerals that can help make claims. Another interesting area here you can see in a big red patch is around inflammation, anti-inflammation and respiratory disease, which both the Actimel and the Wellmune are focused on. So when you look at just generally, it's a few key trends. This shows over the last 20 years, there's been a huge increase in patents that are focused on immunity. And what's shown in the lighter blue is the prediction from the software that we use to work on this. So yeah, I think that it's not going anywhere. And I think with coronavirus and everyone's focus on the importance of protecting and boosting their immunity, I think there's going to be a lot more of these types of patents that come through over the next couple of years in particular. So one of the really quite striking trends that came through in the last report was the huge amount of patent filings from South Korea and China. It's just quite mind-boggling over the last 5 years, how they've significantly ramped up their innovation in the space. So first of all, it shows that our key target markets in Asia, this is something that's really on their minds and a big opportunity, but also that there's huge amount of competition as well. And potentially as well, obviously, when you think about patents, freedom to operate issues as well. So this is just a quick slide showing you the health focus of the when you look at the patents in the immune health space in China. So I shouldn't say, but the ones in red are kind of traditional herbal medicine based patents. So the ones that I just wanted you to focus on, the two on the left hand side: respiratory, non-viral, so asthma and pollution, and also skin health are really big focus areas for traditional herbal medicine, and presumably therefore in Asia. So I think that's a key kind of take home for companies involved with HVN, looking at opportunities for export into China. It's telling us something pretty important here. So I just wanted to mention before I hand off to Michelle that if you go into the reports, which are available on the HVN website, you can see the full insight reports, and there's a whole bunch of other case studies that I went into, very similar to the ones we've talked about today, just talking about how the companies have used their patents and a few learnings here and there about what we can do. Obviously, I'm not going to read them. You can't even read the text here. Just finally, just a couple of quick tips. It's really important to do your background research to increase your innovation efficiency and lower your risk. So like what Biothera did, presumably, is they looked for partnerships that came in, but also then looked at who potentially could acquire them. And obviously Kerry came along. Another important thing that probably a lot of you are thinking right now is, well, we just don't have the funds to support patenting. And New Zealand businesses generally don't have those deep pockets like Kerry and Danone. So it's even more important to really understand your game plan up front. So what is it critically that you potentially do need to patent versus what potentially could you in-license or purchase from an IP point of view? Who could you potentially partner with that already has that IP? How could you steal with pride? I don't know if you've heard this expression before, but are patents that have come off their 20-year period, or for example, they haven't filed in specific countries, there's opportunities to steal with pride. And obviously there's trade secrets, leveraging brand and so forth, and of course, health claims. Thinking outside the square. So a lot of, as I mentioned before, Kerry presumably use their patent to control their use of their health claim. And what Danone did is they actually refer to their patented strain of a probiotic as well, which gets around some of those issues. Really important to use big data to understand critical insights, what companies are doing, what a number of people that I've spoken to, they've kind of mentioned to me in confidence around their concept, and we can actually plug their concept into the big data immune health landscape that we've generated and see what other companies are doing work in the exact area that they're interested in doing, or the exact same concept or idea. And then obviously thinking about your exit strategy at the beginning. So think like Biothera does. Okay, I will pass over now.
So my piece today is focusing around how to access global markets when it comes to these immune-focused foods. There are several considerations to look at when you're looking, especially from a regulatory point of view, as well as taking into account the science, research, and the IP. But the couple that I'm going to focus on today are mainly around the sort of novel foods piece and the health claims piece, because those sort of make up probably the two main considerations, especially when you look at the Wellmune and the Actimel products. When we look at novel foods pieces, as it relates to most products, it looks at whether there is a history of use in the target market. So has this product been consumed as a food in the intended market for a reasonable period of time. And that goes across the board for whether it's an extract, a type of plant, or a microorganism. So that was a question that was raised for both Wellmune and Actimel, because Actimel having a sort of patented version of Lactobacillus casei, but the decision there sits around, well, Lactobacillus casei is already a very well-known microorganism, has a very long history of use, so they managed to dip out of that novel foods piece. And then the question also did come up with Wellmune and the beta-glucan from yeast. There is quite a lot of approved claims around beta-glucans from oat and barley, but there isn't anything at this stage with the yeast version. So that was really asking the question around, like, was this something that was a highly refined product that was reasonably different to the oat and the barley versions? And originally they were looking at a formal assessment of, is this a novel food and is it safe? It was considered potentially novel on the basis that it had a different source to oat and barley. So there was questions around, did the tox data match what was there for the other types of beta-glucans? Was it be consumed in the same way as those others? And the end result was that there was a small amount of extra safety data done around subacute toxicity, just to demonstrate that there wasn't anything untoward happening with consumption. But because the source material was baker's yeast, and there is a long history of use of baker's yeast itself, that was considered enough without having to go through an entire full novel foods assessment process with EFSA. But if something is considered to be completely novel, then there is this entire formal assessment piece that must be done, and it looks across the board at all of these sorts of areas, because the intention of the regulators is that there needs to be proof without any kind of a shadow of a doubt, really, in their mind, that if the population is consuming this food or this ingredient, there isn't going to be any safety concerns when that happens. And there also does need to be some link back to a potential benefit around why would this novel food be approved if there wasn't any kind of a benefit led to it. Both Wellmune and Actimel have mainly operated a lot within the European market, so they've all come under the EFSA framework, which is one of the higher regulated frameworks when it comes to the novel foods piece, and as well as the health claims that I'll talk about very soon too. But it is worth noting that every market has its own process when it comes to novel food assessments, and it is about what history of use looks like in that specific market. So if you've got something that is here in New Zealand and it isn't considered novel because there is quite a significant history of use here, that doesn't necessarily translate to other markets as well. Some jurisdictions will take into account if there has been a long history of use in the original country. And certainly New Zealand does that when looking at foods from overseas that are coming here as well. They do take into consideration, is there a long history of use in the original market, and did that by virtue demonstrate a high level of safety to go with it. There are some markets such as China, which essentially just require their entire own process if there is no history of use within China, and the entire assessment process is done based on testing inside China as well. So it's a little bit more difficult to jump across to demonstrate safety in larger markets and then take it across to someone like China. And the same with EFSA as well. So if you started with an EFSA approval, that can be really useful for a lot of other markets, but at the same time, they still do have their own considerations in place as well when it comes to novel foods. And the other big piece, especially for these two products that we've been talking about today, is the type of claims. So there's three main categories when it comes to claims for foods. Nutrient content claims and health maintenance claims are very much achievable for foods. And then the borderline obviously sits with therapeutic claims, which are outside of the food space. Nutrient content claims are very straightforward, and it is on the basis of it does or does not contain a particular nutrient. When it comes to health maintenance claims, across the board globally, there is some level of pre-approval for health claims, and there is a process around demonstrating that there is a health effect and how that health effect actually happens. So that's where it sits with how did this happen between Actimel and Wellimmune. So both of those products did have health claims submitted through to EFSA as part of some of the original rounds of getting approved health claims in the EU, and both did receive negative opinions on that basis. And as both Ollie and Peter have touched on, when it comes to probiotics, because it is very difficult to actually understand the exact mechanisms of action and how that actually influences things within the human body, that is why you're seeing no approved health claims in relation to probiotics. And as you will have seen from what Peter has said about what has happened with the patent activity with Danone, it's very much a case of they're looking at patenting new organisms for the purpose of showing innovation. However, there seems to be very little movement within the health claims application space around actually pursuing a health claim for any probiotic at this point. When it came to Wellimmune with the beta-glucan, but there are, as I said, there are health claims around oat and barley beta-glucans, and those have focused on heart health, cholesterol management type claims, whereas this one was starting to look very much at something far more in the immune space. The original health claim application that they had made reference to the fact that there wasn't sufficient clinical data of the quality that EFSA expected to be able to get a health claim, as well as there wasn't the direct link to an immune effect. The claim was sort of relating to increasing body's defences to reduce the risk of common colds, and the comment back was that incidences of common colds are not a direct measurement of an effect on the immune system based on EFSA's criteria. So there was a lot of going back to the drawing board for yeast beta-glucan, and they seem to have definitely upped the research game, and they are actually in the process of making a new application for a health claim which is far more targeted and has taken into account some of the deficiencies that were noted in the original research data. So now they are specifically focusing on an immune health claim relating to upper respiratory tract health. So it'll be interesting to see exactly what happens when EFSA finish their review of this proposed health claim, and to see where it happens. But to give a bit of flavour to the investment that was required, so the original application had 10 clinical trials as part of its dossier. And now currently the new dossier looks at probably about double that, and it is very much trials with a reasonably high number of participants, and also looking very specifically at clear endpoints rather than a range of secondary outcomes at the same time. This is where it's quite important when you're going to start going down the road of, is it possible to do a health claim? It's to really understand the application in the intended market. So here in New Zealand and Australia, it's more an opportunity in terms of general health claims to be able to do your own self-substantiation dossier, and essentially you can work with the likes of MPI to actually understand exactly what those data requirements look before the dossier is put together, and there is quite a collaborative process involved. If you're looking at markets such as China, it's a very stepwise approach, and it's very clear exactly what tests they require at what stage. So it's just about following all of the process there. So when looking at this, there's the opportunity to really understand, if you're going to invest in science, exactly what that scientific study needs to look like, and what you need to do around making sure that you're covering any safety considerations at the same time. And then when you tie this all in together in terms of the overall regulatory strategy, as I said, when you're looking at your scientific elements, it's taking into account safety and efficacy. Can you do a study that looks at elements of both at the same time to try and, like I say, maximize the bang for your buck, essentially? It's going in, understanding the complexity with the markets that you're going into to make sure that you are going in eyes wide open around what all the requirements are, and then you can make yourself aware of the complete roadmap in order to make sure that you are still going to get your original consumer proposition across the line, just understanding things like the differences between how you can communicate a health claim versus what you would like to put together in a study. So some key questions to consider is, what does the landscape look like, and what markets are key? If some markets end up being really, really difficult, are they still worth the size of the prize, or is it something to perhaps park? It can be a stepwise approach, as what Actimel have done. They've found that it was really difficult in terms of getting the probiotic, but by leveraging key nutrients of vitamin D and vitamin B6, they were able to access the type of claims that they want while they assess the situation around what was the investment for probiotic work. And the other part around all of this is making sure that scientific study development really fits both the requirements around proof of concept and exactly how a regulator expects a study to be conducted, and what kind of endpoints it needs to be together with all of that. Overall, if you're looking at an immune-focused product, looking at how that fits in and how you can actually talk about that in the market. So if the aim is to really just elevate an innovative ingredient, but at the same time make a standard immune function claim, then that's essentially the same sort of process as what has happened with Actimel, whereas Wellimmune have taken a slightly longer road, but they have decided to really go down the space of looking at a specific claim around upper respiratory tract, which, given the current climate, probably is something that is going to be quite relevant in the coming years. So it's really about understanding which space are you best to play in, and what's the best stepwise approach to get to that end goal. That's all I have for this short and sweet run over of what is in market access spaces. We'll leave it over now to questions.
Thanks very much, Michelle, and thank you to our three speakers. We've just run over time ever so slightly, but perhaps if the three of you are not racing off, we could address some of these questions. So to Ollie, Peter and Michelle, if you can just turn your mute off and just confirm if that's okay, for maybe we stay on till 10 past?
Yeah, sure, that's fine.
Yep.
Okay, that's great. Thank you. And hopefully those of you listening are able to stay with us a little bit longer into your lunch hour as well. So as I said, we will collect these questions up if we can't get through them, and we'll deal with them in writing. So do keep sending them in, or through the chat or email to us. So I'm just going to take them from the top. So the first question we had from Oz Scientific was for Olivier. Great example shared in the webinar. What are the emerging ingredients being investigated for immunity?
Shortly, that's a very good question. So I don't know the entire pipeline throughout the world. I definitely think also although it's quite difficult, I think there's definitely a drive to understand probiotics better. And I think that's also a matter of understanding or like a lack of understanding of us immunologists, how exactly the microbiome works in terms of immune impact. So as soon as we advance a bit in our knowledge, I think that it constantly opens up new opportunities for industry, whether it's for probiotic or other things as well. You know, the more we understand about the immune system, and we're really far from understanding it all, if you discover a new receptor, if you discover a new pathway, that immediately opens up to what can actually impact that particular pathway or that particular receptor. And then it opens up entirely new areas that can be covered by IP. So I don't know what the best emerging ingredients are, but there's definitely a lot of traction in the probiotic field because it has such a profound effect on immunity. And again, other products, I mean, there's definitely emerging products within New Zealand, you know, green shell mussel, but again, the mechanism of action will always be important to determine.
Thanks, Ollie. A quick one for Peter from Ali. Can you please elaborate on stealing with pride strategy?
Yeah, sure. So I guess the first point is that I was referring to patents in particular here. So with the patent, obviously it is a publication, just like any other scientific article, although some would argue that perhaps not the same scientific rigor. But I think the key thing there is that it often can contain an innovative opportunity. And sometimes what happens with patents is it could be a number of things. A company might only file a patent in one country, so it only protects the innovation in that country. So if you find that your markets are in different countries, you can use that without infringing that patent, say in Canada or the US. Another thing to look at is that the patent might have been narrowed, so the scope of the claim is very narrow, and you can get around the patent claim that way. It could be that the patent is actually lapsed, for example. So patents only have a 20-year term, and that's the trade-off. You disclose your innovation for a 20-year term. At the end of that 20 years, it's open for the public. So that's what I'm referring to as stealing with pride. And a lot of people don't realize that there's huge opportunity there in the patent landscape to be clever with working around those.
Thanks, Peter. I'll take a question from Michelle, and then everybody's had a question. So this one's from Richard. Michelle, to you. Could you please compare and contrast FSANZ and EFSA regarding being able to make generalized versus specific health claims?
Yeah, so with FSANZ, when the health claims legislation was finally put into place, it was taken in terms of elements from the likes of EFSA as well as Canada and other jurisdictions around. So it's taken parts of EFSA in terms of what you can do. There is quite a lot of similarities between the two. I think one glaring difference that's kind of jumped out to date is that because there is access in New Zealand around the self-substantiation piece for general health claims here, it's meant that there is the ability for industry to collaborate with MPI, if you're sitting here in New Zealand, to actually work through the exact requirements for that dossier, so that in the end, the outcome is usually quite successful. When it comes to the high-level health claims piece for both countries, it's really, really difficult, and there is essentially no movement in that space in terms of health claims approvals to date, because the rigor is quite exceptionally high, and the expectations around proof of concept are quite high. When it comes to EFSA and general claims, I just think there's been quite a bit of difficulty in terms of exactly understanding EFSA's interpretation in terms of their decisions sometimes. there were a lot of negative opinions right out of the gate when the regulation first opened up. And I think that was because there was a lot of confusion around exactly what EFSA required for proof of mechanism of action and defining the exact ingredient or component that is contributing to the health effect. So it sort of seems to be a little bit longer process when you sit here with the EFSA version versus what you can do back here with FSANZ.
Thanks, Michelle. Another question for Ollie, this one from Karen. What are the implications of nutrition for or on immune cell production at the bone marrow level? Now, I sense there could be a lot of detail behind this question. I'm wondering if we could do this at the briefest version possible, because there's one more question left. If we can get through that in a couple of minutes, and then we can pick up on all the detail one-to-one with people who have these inquiries.
So just in a nutshell, so it has been shown that the Western diet in animals, hasn't been shown in human, has a detrimental impact on hematopoiesis. It's been appreciated that the human immune system, or the mammalian immune system in general, we adapt to our environment, and we haven't figured out all the environmental cues that the immune system takes. It's like a couple of decades ago, people understood that it's just generally the terminally differentiated immune cells which modify their function upon environmental changes. But it's been now discovered that also the bone marrow adapts to your environment, and we don't fully understand how it works. So I don't have a proper answer for that, but it has been shown in animals that if you change the diet, it has a significant impact on hematopoiesis. So it's very likely to happen in humans as well. So that's a brief answer.
Thanks, Ollie. So the last question is actually for both Peter and Michelle. If both of you can see on the chat function, it's quite a lengthy question, so I'll read it, but you both might want to scan through. So this is from Simon at HVN. He's essentially saying, because New Zealand is so small, and we also have a small number of companies, actually how viable is patenting as a means to protect IP? Also, how much cash reserve does a company need to deal with any associated litigation and challenges from competitors? Could you put this in some sort of context, such as number of patents typically needed before a return on investment is realised, and how large a company usually is in order to be successful in the patent arena? Well, that actually sounds possibly more like a Peter question, at least first up, but Michelle, jump in if there's anything you'd have to add.
Yeah, I'll try and answer everything, but I think probably the biggest take home is that due to New Zealand's size, I think there's even more importance to patent, because it's very difficult to compete on speed with and scale with other companies around the world. So by securing your IP, it gives you that ability to establish that competitive advantage in the marketplace. Another key thing is that patents can just be an intangible form of IP. So instead of exporting all of our actual products, we should start thinking more smartly as a country and exporting our know-how in the form of intellectual property, so licensing our IP that we develop in New Zealand. So I think that's two key important parts there. Obviously, when it comes to how much money do you throw at patents, that is, as I mentioned in the last slide, it's really important that you develop your IP strategy from the start and be willing to be able to pivot as you go through. Things are learned as you go. It's not advisable to just go out and patent everything, obviously. Think about the competitive advantage that your company has. Can you rely on the New Zealand Inc. message when you're thinking about your competitive advantages and how you can link your brand into that? Obviously, patenting is the key thing, is where it's really difficult to retain as trade secrets. So if somebody can reverse engineer, that's probably a key indicator for you to think about, well, maybe it's important here to put a patent on it. But again, if you can retain that as a trade secret, then it might be more advisable to do that. Hopefully I've answered your question. I don't think there's like a magic bullet in terms of this is how much you have to invest before you're going to get a return. I think it's totally dependent on what market you're in, what your commercial strategy is it's not just about what patent you've got. You've got to be thinking commercially as well as to how you're taking your product to market and what your consumers actually want.
Thank you, Peter. Michelle, did you have anything further to add?
No, I think that it definitely does speak to the piece around looking more to leverage selling knowledge rather than specifically selling ingredients overseas, but also looking within just even the two elements that I've talked about today. The IP piece is really important because quite often there isn't the ability to maintain trade secret in some applications. So having that IP protection piece on top really protects all of the investment if you're either going down a novel food or a health claim road.
Okay, thank you very much, everybody, and really conscious of time. Thank you for those of you that have been able to stay with us, and given that this is being recorded, we'll do a little summary for another couple of minutes just because many will hopefully view this in time to come. In the context of creating immune-enhancing foods for global markets, then certainly take these messages away, do your homework, know who you can work with, who has the expertise, and you can formulate a strategy from there, which could be, I think through the two case studies that we've provided as examples today, you can see two quite clear different strategies. One of them there is that you can work with a formulation with a number of fairly well-known ingredients that have well-established evidence of efficacy around immune-enhancing benefits or supporting a healthy immune system. So generally the sort of vitamin-type mineral messages that we saw attached to the Actimel product. And what that strategy is sometimes known as is the health halo approach. So whilst that contains the probiotics and there's plenty of work going on there to advance the knowledge and understanding of the immune benefits with those types of ingredients, there's still some ready-made claims to be accessed and products to be launched. So that's one strategy. The other strategy is like the Wellmune product, which is actually focusing very much on one or two specific, quite novel, innovative ingredients and really building that base of science to have these, innovative areas that where new patents can be found, etc. So again, depending on the support that you have, the finance, what your aspirations are as a company, there's these different options. And I think the key for us is to provide the support the best that we can with our technical expertise, and also to work with the likes of High Value Nutrition Science Challenge, both in terms of accessing the funding available, but also that scientific expertise, which helps to understand what those scientific effects might be and can be proven, and then you're allowed to say in market to have the greatest success. So we'll finish there, and thank you again so much for everyone for your time. It's that time of the year even to wish you a happy and healthy holiday and happy Christmas, and we look forward to seeing you all again in 2021. So ngā mihi nui.